Premature ejaculation, PE, is one of the most common sexual concerns for men, yet it remains a topic many avoid discussing openly due to the stigma surrounding it. It can affect men of all ages, though it is most frequently reported among younger men or those new to sexual activity. While it is often misunderstood, PE is more common than most people realize, and its impact extends far beyond just timing. It affects a man's self-esteem, emotional well-being, and his relationship with his partner. Premature ejaculation is generally defined as the inability to control ejaculation during sexual intercourse, causing the man to ejaculate before he or his partner would like. For many, this happens shortly after penetration or even before it, leading to feelings of frustration, embarrassment, and dissatisfaction for both partners. To be diagnosed with PE, it must occur consistently for at least 3 months and cause significant distress or relationship strain. However, what constitutes normal ejaculation timing varies widely from person to person. Research suggests that the average time to ejaculation during intercourse ranges between 5 to 7 minutes, but this is just an average. Some men may last longer or shorter than this and still be perfectly normal. The key is whether both partners are satisfied with the sexual experience. If premature ejaculation is causing distress, it's important to consider it as a problem that can be addressed. The causes of premature ejaculation are typically divided into psychological and physiological factors, though both can work in tandem to exacerbate the condition. On the psychological side, performance anxiety is one of the most significant contributing factors. Men may fear not being able to satisfy their partner or may feel pressure to perform in bed, leading to rushed or premature ejaculation. This anxiety can create a vicious cycle where the fear of PE actually causes it, which then reinforces the anxiety. Other psychological contributors include stress, guilt, or insecurities that affect a man's confidence in the bedroom. For example, cultural or religious beliefs around sex can induce feelings of shame, making sex more of a mental burden than a pleasurable experience. In some cases, men who have had negative sexual experiences in the past, such as not being able to satisfy a partner, may develop performance anxiety, further contributing to PE. Similarly, men who experience issues with communication or intimacy in their relationships may struggle to engage in sex comfortably, leading to hurried encounters. These emotional roadblocks can affect a man's ability to maintain control over his sexual arousal, ultimately resulting in premature ejaculation. On the physiological side, there are several factors that can contribute to premature ejaculation. Hormonal imbalances, neurological conditions, and certain medical issues are among the most common culprits. Research suggests that lower levels of serotonin, a neurotransmitter involved in mood regulation, may also play a role in how quickly a man ejaculates. Men with lower serotonin levels often find it harder to delay ejaculation, as serotonin helps regulate the timing of orgasm. Additionally, conditions like erectile dysfunction, ED, prostatitis, inflammation of the prostate, or even certain neurological disorders can impair the function of the ejaculatory reflex, making premature ejaculation more likely. Another physiological issue that can contribute to PE is a heightened sensitivity of the penis, where sensory stimuli trigger ejaculation too quickly. This might be linked to the way the body develops during puberty or to habits like frequent masturbation, which can desensitize the body over time. Though these physical causes are often more complex, they can play a key role in whether a man experiences premature ejaculation. The impact of premature ejaculation goes beyond the physical or medical. The psychological and emotional effects can be profound. Men who experience PE often struggle with feelings of shame, embarrassment, and frustration. These negative emotions can erode a man's self-esteem, leading to a loss of confidence in his sexual abilities. Over time, this can create a barrier to open communication with a partner, which can further strain the relationship. Many men with PE may avoid sex altogether, fearing another premature ejaculation episode, which leads to emotional withdrawal from their partners and the potential for deeper relationship issues. This avoidance can perpetuate the cycle of anxiety and sexual dysfunction. Partners, too, may feel confused, disappointed, or disconnected, particularly if they do not fully understand the issue. Without open discussions about the problem, misunderstandings can arise, making it more difficult for both individuals to feel emotionally supported. However, the good news is that premature ejaculation is a treatable condition. There are multiple treatment approaches available, depending on the root cause of the problem. Behavioral techniques, such as the stop-start or squeeze methods, are often the first line of treatment. The stop-start technique involves stimulating the penis until the man feels close to ejaculation, then stopping the stimulation until the feeling subsides. This process is repeated, helping the man gain better control over his ejaculatory reflex. The squeeze method is similar, but involves applying gentle pressure to the base of the penis just before ejaculation to reduce the sensation of impending orgasm. Over time, these techniques help men delay ejaculation and feel more confident in their ability to control the timing of their orgasm. In addition to behavioral therapy, psychological counseling can be very effective. Cognitive behavioral therapy, CBT, can address the anxiety and negative thought patterns that often accompany P, helping men build their confidence and overcome the psychological barriers that contribute to premature ejaculation. For men whose P is linked to relationship issues, couples counseling may also be helpful in improving communication, resolving emotional tensions, and fostering a more fulfilling sexual relationship. For men who require medical intervention, there are several options available. Topical anesthetics, such as creams or sprays containing lidocaine or benzocaine, can be applied to the penis before sex to reduce sensation and help delay ejaculation. These products are often effective and non-invasive, providing a quick solution for many men. In some cases, doctors may prescribe medications, such as selective serotonin reuptake inhibitors, SSRIs, which are typically used to treat depression, but also have the side effect of delaying ejaculation. SSRIs like paroxetine, sertraline, or fluoxetine can increase serotonin levels in the brain, which helps regulate the timing of orgasm. While these medications can be effective, they may take several weeks to show results, and side effects like nausea, dizziness, or reduced libido may occur. Another treatment option is the use of pelvic floor exercises, commonly known as Kegel exercises, which strengthen the muscles involved in ejaculation. These exercises involve contracting and relaxing the pelvic muscles, which can improve control over ejaculation. Strengthening these muscles not only improves sexual function, but also enhances sexual pleasure. Lifestyle changes can also play an important role in improving sexual health and managing premature ejaculation. Regular exercise, a balanced diet, and stress management techniques such as yoga or deep breathing can help reduce anxiety and improve overall health. Men who are heavy drinkers or smokers should consider cutting back, as alcohol and nicotine can both impair sexual function. Additionally, addressing other health conditions, such as erectile dysfunction or prostatitis, can improve sexual performance and reduce the likelihood of premature ejaculation. Reducing stress and increasing communication with a partner can also help men feel more relaxed during sexual activity, leading to greater sexual satisfaction for both individuals. Ultimately, premature ejaculation is a treatable condition, and there is no reason for men to suffer in silence. By understanding the causes of P and seeking appropriate treatment, men can regain control over their sexual experiences and rebuild confidence in their relationships. Whether through behavioral techniques, psychological counseling, medical treatments, or lifestyle changes, there are effective solutions available. It's important for men to remember that premature ejaculation is not a sign of failure, and it is not something that has to be endured alone. With the right support and treatment, men can overcome premature ejaculation, enjoy more satisfying sexual encounters, and improve their overall well-being.